Now we'll look at the other diseases, so those not classified as hemorrhagic or non-hemorrhagic fever diseases, but also impact the cardiac or lymphatic system. We do want to talk a little bit here about COVID, the SARS-CoV-2. This is one of 7 members of the Coronaviridae family that infects humans. There are hundreds, so this is not something new. There are hundreds that infect other animals, but all of these are enveloped positive sense RNA viruses, and they have spike proteins. And that spike protein is what attaches to ACE2 host cells. So that determines which cells they can attach to. And those proteins are found on the surface of cells throughout the body. So lung, brain, heart, etc. So they're found in multiple places. And this is what causes so many different symptoms to occur, is because it can each person seems to be impacted by which cells they're actually able to infect. But again, in order for them to attach, they have to attach to a cell and a protein on that cell. These viral particles are, of course, airborne and transmitted through respiratory droplets. Some of the signs and symptoms, again, because it can infect so many different cell types, is one of the reasons that we see such a wide variety of symptoms with this. I do think this is going to be one of the really interesting things to study as we continue to learn more and more about this virus. It's just the range of symptoms. So is it due to different genetic genetic factors as far as that ACE protein, or what is it that leads to such a variety of symptoms that we see with this? So prominently, it is a respiratory disease. These infections set off essentially an immune response to cytokines being released, leads to hyperinflammation. So again, sometimes it's the effect of the immune system that damages us more than the virus or the bacteria itself. But that causes that hyperinflammation in the lungs and other organs. So some of the systemic effects, so we can see things like rashes, muscle pain, heart damage, joint pain, blood clots. Also considered neurotropic, so we mentioned it with our neuro diseases as well. But some of the common symptoms include a loss of taste and smell, also some headaches that can occur. So about a third, though, of these infections are actually asymptomatic and relatively mild. Just a little summary table here, again, caused by that coronavirus, transmitted by droplets and airborne. Again, their virulence is that they can attach to those ACE2 proteins, and they can actually induce some autoimmunity. Of course, prevention, there's a COVID vaccine. Of course, there are multiple strains of the virus, so the vaccine is only effective against limited strains. So as it continues to mutate, the vaccine, kind of like the flu, only is effective against the strains it's effective against. There are some antivirals out there. Again, virus is hard to treat because they are so, they kind of hijack our cells, so it's hard to target them. All right, so endocarditis is the inflammation of the inner lining of the heart, which is called the endocardium, hence the name endocarditis. And this can present as acute or subacute. We'll talk a little bit more about that in a minute. But actually what's been found is that damage to heart valves, or someone who's received prosthetic heart valves, actually predisposes individuals to endocarditis. And then it also can be caused by vascular trauma or circulating immune complexes. So remember, the immune system, sometimes the antibodies and the antigens kind of form a big clump, or these immune complexes, and that can increase the chances of developing endocarditis. Some of the signs and symptoms, first of all, of the acute, so fever, anemia, abnormal heartbeats, can kind of seem like a heart attack, shortness of breath, chills, can also cause some abdominal or pain in the side, some different lesions that can occur, or swelling of the lymph nodes or ocellular nodes. If we look at the subacute endocarditis, similar, but this just develops more slowly. Again, acute is kind of quick, whereas subacute is a little slower, also less pronounced symptoms. And then along with those, enlarged spleen, some clubbed fingers and toes can also occur. Our table here, so looking at the endocarditis, multiple bacteria can cause this, from Staph aureus, pyogenes, a couple Enterococcus, Pseudomonas, and others that can cause acute. And again, it just means kind of a quick onset of symptoms, parenteral, mode of transmission. Prevention is by having aseptic surgery. So again, this is introduced by some type of injection or surgery. So being sure that these are aseptically or with no outside bacteria being added. Can be treated either with surgery to remove it or with vancomycin antibiotic. And again, acute onset has a high fatality rate. Because again, by the time it's diagnosed, sometimes the damage is too extensive. The subacute is caused by some other bacteria, so alpha hemolytic, streptococci, and others. It's endogenous transfer from the normal biota. So again, there are normal bacteria in our that are in the body. If those, however, get into the bloodstream, then they can become dangerous. So again, that normal flora is good, but whenever it goes someplace it's not normally found, that's whenever we get problems. So prophylactic antibiotics before invasive surgery. So individuals who have had a knee replacement, if they're going to have dental surgery or anything that's somewhat invasive, typically they take an antibiotic before that, and that just decreases the chances, again, of getting those normal flora someplace they shouldn't be. Then broad spectrum antibiotics in surgery can be used. Again, the difference here is that slower onset of symptoms. All right, looking at a different type of an infection besides endocarditis, so we can also get sepsis. I mentioned this earlier with some of the terminology, also called septicemia, and this occurs whenever organisms are actively multiplying. So not just present in the blood, but they're actively multiplying. So this can be caused by a variety of bacteria or fungi. Again, bacteriemia or fungemia means that those are present, but again, if they're actually multiplying, that can lead to sepsis. Some of the signs and symptoms, so fever can occur, some altered mental state, shaking, chills, some GI symptoms, also increased breathing rate, respiratory alkalosis or increase in pH, low blood pressure from a loss of fluid from the vasculature. Endotoxic shock can occur from gram-negative bacteria. So they have that LPS, or referred to as endotoxin. So again, all gram-negative have that on their outer membrane. So that alone by itself can cause this endotoxic shock. Because what happens, regardless of the type or of the specific bacteria, any gram-negative with that LPS endotoxin can cause a massive inflammatory response. And what that does is it leads to a drastic loss of blood pressure. So those can instigate kind of similar series of events whenever fragments of the cell wall get released into the bloodstream. All right, so if we look here at the sepsis table, so again, bacteria or fungi can get into the bloodstream and start dividing. Again, it has to be, though, kind of put in there, so parenteral or endogenous transfer. Again, the virulence is that endotoxin, so that LPS in the gram-negative cell walls, or other membrane components. Treatment is with that broad spectrum antibiotics. This is urgent treatment, just because, again, once those bacteria or fungi get into the blood, they can then essentially go anywhere. So again, urgent threat list. Moving on to the plague. So there are three kind of manifestations of it. So they have the pneumonic plague, which is the respiratory disease, bubonic plague. This causes inflammation and necrosis of the lymph nodes, or the buba, hence the name bubonic plague, which is in the groin or axilla. And then septicemic plague, which is why we have it here in this chapter. This disseminates or results in disseminated intravascular coagulation, so clotting, subcutaneous hemorrhaging. We also get these purpura that degenerate into necrosis and gangrene. So this is referred to as the Black Death. It does have a high mortality, even with treatment, and 100% mortality without it. It is caused by a bacteria called Yersinia pestis. It is transmitted by fleas, but also by droplet contact, which would be the pneumonic, or direct contact with body fluids. It does have a capsule, which makes it harder for phagocytes to get a hold of it, and it has this plasminogen activator, which causes the impacts on the blood. So animal or flea and animal control helps with this. Also, there is a vaccine available for those that are at high risk. Can be treated with some antibiotics, so streptomycin and ciprofloxacin or fluoxetine. And this is also a bioterrorism agent. All right, our next one is toluramia. This is zoonotic, again, meaning it comes from those animals. It's endemic to the northern hemisphere. Some of the symptoms, so headache, backache, fevers, chills, malaise, tiredness, or weakness. Some of the signs that we can actually see, so ulcerative skin, as the picture here shows, swollen lymph nodes, conjunctival, so in the eye, inflammation, sore throat, intestinal disruption, and some pulmonary involvement. About 30% mortality without proper treatment. It is caused by Francisella tularensis. It's a gram-negative facultative intracellular bacteria. Doesn't take a lot of it, so only about 10 to 50 organisms is all that's needed for an infection to occur. So it is also on our bioterrorism list. Rabbits and rodents, rabbits and rodents, including muskrats and ground squirrels, can be the main reservoir for these, but others there can also serve as reservoirs for this bacteria. Our table here, again, the Francisella tularensis, again, transmitted by the ticks, but also some direct contact, and it is also airborne. Again, virulence is that intracellular growth, just meaning once it gets into the cell, kind of like a virus, it is so able to survive and reproduce. Can be treated with a couple antibiotics, gentamicin and streptomycin, and again is on one of the bioterrorism agents. Next is Lyme's disease. This is one, unfortunately, we're learning more and more about. So first discovered in Old Lyme, Connecticut, hence the name, that's where it came from, Lyme's disease. This was in the 70s. It is a slow-acting progressive syndrome. Early symptoms include this bullseye rash that we see over here in the picture following a bite. So we get fever, headache, stiff neck, and dizziness. That progresses into some cardiac and neurological symptoms, and ultimately becomes this crippling polyarthritic or arthritis, so multiple joints getting inflamed within weeks to months. It is caused by Borrelia burgdorferi, which is a spirochete. That's what our picture over here is showing, are these bacteria in the spiral form. It does invade the immune system, or it evades the immune system by changing its antigens. So again, antigen is what our antibodies recognize. So if they can change those antigens, it no longer activates or no longer is recognized by our antibodies. So again, it has multiple proteins that it uses to attach, and each of those can kind of change a little bit to change the ability of our immune system to recognize it. So it is possible that the immune response contributes to the pathology. So again, unfortunately, sometimes as the immune system is working, that inflammation and the cytokines can cause as much damage as the bacteria or virus itself. Our table here, again, the Borrelia species, again, transmitted by tick bites. This antigenic shifting, is how it's able to change those proteins. Again, that prevents our immune system from continuing to recognize it. Also, adhesive proteins that allow it to attach. Again, avoiding ticks is how it can be prevented. Can be treated with doxycycline or amoxicillin, but typically a long treatment, 3 to 4 weeks, is typically what is given. All right, infectious mononucleosis, or just typically referred to as mono or the kissing disease. This is caused by Epstein-Barr virus. So it shares kind of the same shape, morphological and antigenic features as other herpes viruses, but this contains a circular form of DNA that's readily spliced in the host cell. It does have a latency period, and also, again, that ability to splice into the host, just meaning it becomes part of our DNA, allows it to evade the immune response. More than about 90% of the world's population has been infected with one of these Epstein-Barr viruses. And again, infections during the teen years results in diseases at about 30 to 77% of the time. Just looking at this, the Epstein-Barr virus, direct contact, also indirect or parenteral mode of transmission. Again, it can become latent and has the ability to become part of our own or incorporate into the host DNA, so it can hide that way. So supportive treatment is what is given, and this lifelong persistence, so it continues to be an issue throughout the lifespan. If we look at anthrax, this has kind of multiplies in large numbers in the blood, so it leads to that septicemic anthrax is a possible outcome of all forms. So again, if it gets into the bloodstream, it is able to multiply there. So this is an issue with any type of anthrax. It is a zoonotic disease of herbivores, and these infections have symptoms that change. So cutaneous anthrax is on the skin, pulmonary is on the lungs, gastrointestinal is of course in the gastrointestinal tract, and then in the central nervous system we have anthrax meningitis, which we mentioned earlier in those diseases. The causative agent is Bacillus anthracis, which can form endospores as we see over here in our picture. So these are able to form those endospores, so it can become dormant. It is hard to treat. It is aerobic, catalase positive, so it can break down hydrogen peroxide. Some of the toxins that it produces, there are actually 3 of them: edema factor, so that's swelling, protective antigen, and a lethal factor all get produced by this bacteria. Looking at our table again, Bacillus anthracis, vehicle mode of transmission, also indirect, so from the animal hides, but also in food. Again, it has that triple exotoxin to cause its virulence. There is a vaccine for those at high risk, and it's used in conjunction with antibiotics after exposure. So treatment is typically through consult with the CDC. but it is one of our bioterrorism agents. Right, Chagas disease is caused by Trypanosoma cruzi. This is actually a protozoan that's flagellated, so it has flagella on it. It's actually similar to the African sleeping sickness. So we have some acute signs and symptoms. Those are typically mild to severe fever. We have some nausea, fatigue, schwannoma at the bite site, swelling of the eyelids. Then some of the chronic effects are inflammation and disruption of the heart, which is why it's in this chapter, but also the brain and the GI system. Again, here is this flagellated protozoan in a blood smear that we can see. Again, looking here at our table, so again, it is transmitted by a tritomine bug, and also vertical, so from mom to infant. Antioxidant enzymes are made co-opting host antigens, so it looks like us, and it can induce autoimmunity. So insect control and treatment is by consulting with the CDC, and this is considered an NPI, or neglected parasitic infection. Right, malaria, which is a huge problem, especially in Africa, but as we increase travel, can become something that we see here in the United States as well. Kind of delayed onset of symptoms 2 to 3 days after, and we get malaise, fatigue, aches, nausea, also chills, fever, and sweating. We have a couple different types here. Falciparum malaria, this has a persistent fever, cough, weakness for months without relief. And then we also have cerebral malaria. So this is where the small blood vessels in the brain become obstructed. It can cause coma or even death. This is caused by Plasmodium species, so apicomplexine. So these actually live in the animal host and lack locomotor appendages in their mature state, so they can't move. They also have an asexual phase that's carried out in humans, and then a sexual phase that is in those mosquitoes. So a couple different stages here, multiple species of Plasmodium that can cause malaria. All right, some of the pathogenesis and virulence factors. So the life cycle, the merozytes, they are able to invade the red blood cells that cause a release of those fever-inducing chemicals in the bloodstream that leads to that. It actually metabolizes glucose at a high rate to get energy and damages our red blood cells, which causes low iron or anemia. Accumulation of those viral products in the liver and the immune stimulation in the spleen can enlarge multiple organs. The red blood cell adhesion to blood vessels in the brain adds to that, so it increases the risk of a heart attack or stroke. The parasite can undergo that antigenic variation, again, just being able to change the appearance of some of its proteins or antigens, which changes the ability of our antibodies to recognize it. All right, our table here, so the Plasmodium species, it is transmitted by mosquitoes or also vertical, again, mom to infant. It has multiple life stages here, lots of antigenic shifting that can occur. It scavenges and takes up our glucose, does have a toxin and the ability, some cytoadherence. So controlling the mosquitoes is an important way. So using bed nets for children, like in Africa where it's endemic, when there is a vaccine, and also prophylactic anti-protozoal agents can be given after an infection. So some of the treatment here, so kind of some combination, consulting the World Health Organization is important as well. All right, and then with HIV, this was isolated in the 80s. This is a retrovirus, meaning it's an RNA virus, but it has the ability to go from RNA to DNA, which is backwards. In our cells, DNA is transcribed to RNA that's then translated to protein. But these RNA viruses are able to use their RNA to make DNA. This, of course, causes AIDS, acquired immune deficiency syndrome, lots of different symptoms that are seen. So pneumonia is very common, caused by Pneumocystis jirovecii. So we mentioned this one earlier. Kaposi, sarcoma, sudden weight loss, swollen lymph nodes, and just a loss of the immune function. Some of the initial symptoms that we'll be seeing, fatigue, diarrhea, weight loss, neurological changes, lots of opportunistic infections. So again, once the immune system is busy fighting something else, other bacteria that are kind of typically kept under control are now able to start replicating at a higher rate. So that's viruses, bacteria, fungi, etc. So again, having that original problem allows other problems to come about. This severe immune deregulation just meaning the immune system isn't being regulated the way it should be. We also get some hormone imbalances and some metabolic disturbances, and that can lead to some weight loss, diarrhea, poor nutrition or absorption, so a lot of weight loss that occurs due to that. Protracted fever, fatigue, again, because we're not absorbing those nutrients, sore throat, night sweats, but then also lesions on the brain, or the meninges, the spinal column, or the peripheral nerves. The retrovirus that causes HIV and then onto AIDS is called a lentivirus. Again, because it's a retrovirus, it needs its own enzyme because we don't have this reverse transcriptase enzyme here that they do. So that's what catalyzes the replication of DNA from single-stranded RNA. So again, that's a reverse of how our body handles DNA and RNA. So this viral genome, though, becomes permanently integrated or part. So it takes RNA and goes to DNA, and then that DNA actually gets incorporated into our chromosomes. There are two major types. The most dominant is HIV-1 that is most related to that's seen in chimpanzees, but there is also an HIV-2. So some of the treatment, so as soon as possible after an HIV diagnosis, treatment should start. It's really a cocktail, so we have an antiviral chemotherapy, trying to kill the cells that are infected, a variety of drugs that prevent or treat the opportunistic infections. So again, not directly treating the HIV, but trying to prevent some of those opportunistic infections or other complications. This 3-drug cocktail, though, has some analogs to inhibit the reverse transcriptase. Again, that's not something that our body makes, so that's a nice target, something unique to the HIV. So again, how these drugs actually work. So these nucleoside analogs that inhibit reverse transcriptase. So again, here is that enzyme that is able to take viral RNA and use it to make DNA, which is not something that is normal. We also have protease inhibitors that can be used. So whenever the proteins are made, an enzyme called protease gets released. So these protease inhibitors, so this HIV protease that cleaves proteins into to activate the proteins, a protease inhibitor prevents that enzyme from working, so the virus isn't able to mature. And then there's also an integrase inhibitor, and this is actually being shown here, so it comes into the nucleus. So this integrase inhibitor then prevents the action of that enzyme. And then our summary table here. So again, HIV 1 or 2, typically 1 is what we see the most of. So there can be direct contact, so it is considered sexually transmitted. parenteral, so blood-borne, and then vertical, so again, going from mom to infant. Some of the virulence is it's able to attach to those immune cells, causes them to kind of fuse together, that Syntia. Reverse transcriptase is unique, that takes the RNA to DNA, and then it does have a high mutation rate, which is what makes it so hard to treat, is that if an antibody recognizes one part of the virus, it quickly can mutate or change. Now those antibodies no longer recognize it. And this is also what makes a vaccine hard, is the more that something mutates, the harder it is for a vaccine to be effective. So avoiding contact with an infected sexual partner, contaminated blood, so lots of blood screening, but also in breast milk, and then that pre-exposure prophylaxis for those at high risk. So the treatment, again, an antiretroviral regimen is what is used to attack something specific to the virus. All right, and then just kind of ending this with our summary tables here that are just looking at the types of organisms and the diseases they cause. So only 1 gram-positive spore form, and that's the Bacillus anthracis that causes anthrax. A few gram-positive bacteria, and these make up part of that acute endocarditis that is caused by a variety of bacteria. And then looking at our gram-negative, which is where we get the majority of them. So acute endocarditis, the plague, tularemia, Lyme's disease, brucellosis, Q fever, cat scratch fever, trench ehrlichiosis, anaplasmosis, and the spotted fever. These are all caused by gram-negative bacteria. The Epstein-Barr virus that causes mono is a DNA virus. Then the RNA viruses, we have those that cause COVID, yellow fever, dengue, some of the hemorrhagic fevers, Ebola and Marburg hemorrhagic fevers, and the Lassa fever. And then HIV that we just talked about is caused by one of those retroviruses. So it's an RNA genome that can be used to make DNA. And then a few protozoans here, so the babsiosis, Chagas, and then malaria are all caused by protists.